The final learning objective for the terminology module is to be familiar with common roots, prefixes and suffixes. Roots, prefixes and suffixes are all just parts of larger words, and by understanding these parts, we can work out the meaning of larger words even if we have not specifically seen that word before. So beginning with the root of a word, and the root is the primary meaning of that word. For example, the root cardia refers to the heart, so you know that any time you hear or see a word with cardia in it, it's referring with something to do with the heart. So cardiac refers to the heart, a cardiogram records the muscular activity of the heart, and a cardiologist is a specialist in the study of the heart. A suffix is the end of a word which gives that word meaning. So for example, the suffix "site" relates to a mature cell. So a myocyte is a mature muscle cell, an osteocyte is a mature bone cell, and a phagocyte is a mature immune cell. A prefix then sits on the other end of the word. It's the start of the word which modifies what it means. So as an example, the prefix hyper means higher or beyond normal. So hyperglycemia is a higher than normal blood glucose level. Hypertrophy is an increase in muscle size. And hypernatremia is a high concentration of sodium in the blood. We then also have what we call combining forms or letters, which combine the root of the word and then the rest of the word. This is quite often the letter O. So for example, the gastrointestinal system, gast refers to stomach, intestinal refers to the intestines, and then the O in gastrointestinal is the combining form. So putting all of that together, and here we have a visual representation of that information. So we have the term hyperthyroidism. Hyper is a prefix, which means higher than normal. Thyroid is the root of the word, so here it's referring to the thyroid gland. And then ism is a suffix which refers to a condition. So without even knowing this term, you can roughly work out that it's a condition of an overactive thyroid gland. So to get you started on breaking down some larger terms, we have a few examples here. And the first column there says root, but these examples do include roots, suffixes, and prefixes. So our first root word is ab, which means from or away from. And the example we have here is abduction. So this could be the movement abduction, where you take a limb further away from the midline of the body. Or you could think of abduction like you're abducting a child, so you're taking that child away. Bi means two. So our biceps brachii muscle, as an example, has two heads or two parts to that muscle. A bi-weekly meeting happens either every 2 weeks or twice a week. Exo refers to outside of something. So the exoskeleton of a bug is the hard external layer of that bug. Exocytosis is the movement of substances outside of a cell. Hyper, we've already talked about. It refers to something as beyond normal. So for example, hypertension is high blood pressure. Hypo is then the opposite of hyper, so it refers to something as below normal or low. The example here is hypoglycemia, which refers to low blood sugar. Supra refers to superior or above. The supraspinatus muscle is a muscle that sits above the spine of the scapula. Infra refers to inferior or below. So the infraspinatus muscle is then a muscle that sits inferior or below the spine of the scapula. Inter means in between or among. So the intercostal muscles sit between the ribs. The interventricular septum is the septum or the tissue between the two ventricles of the heart. Itis refers to inflammation. So tonsillitis is inflammation of the tonsils. Meningitis refers to inflammation of the meninges of the brain. Peri means around or surrounding something. So the periosteum is the covering which surrounds a bone. The pericardium is the membrane that surrounds the heart. Myo refers to muscle. So a myoblast is an immature muscle cell. Myocarditis is the inflammation of the muscle of the heart. Ost refers to bone. So osteoporosis is a bone condition. Chondro refers to cartilage. A chondroblast is an immature cartilage cell. A blast is an immature cell, so an osteoblast is an immature bone cell. And then cyte, as we have already mentioned, is a mature cell, so an osteocyte is a mature bone cell.